So you will perform the prism cover test, or this is called prism alternate cover test.
अस्सलाम वालेकुम, मेरा नाम डॉक्टर मोमिना है और मैंने आपकी आंखों का मुआयना करना है। इस दौरान आपको तकलीफ़ नहीं होगी। अगर किसी भी लम्हे आपको तकलीफ़ होती है तो आप बता दीजिएगा, मुआयना रोक दिया जाएगा। इजाज़त है आपकी? ठीक है। फर्स्ट ऑफ ऑल वी परफॉर्म द हर्शबर्ग टेस्ट। ऑन हर्शबर्ग वी ऑब्जर्व दैट देयर इज लेफ्ट डाइवर्जेंट।
Loud, please, loud.
On Hirschberg's, we see that there is a left divergent squint of more than 45 degrees. या पढ़ सकते हैं इसके ऊपर क्या लिखा है? जी, इसको सामने रखिए और इसको पढ़ना है आपको।
So ideally the cover, uncover and alternate cover test, prism cover test should be done in bifoveal fixation. Okay, so we will do.
इसको पढ़ते रहिए। On covering the right eye, the left eye does not take up fixation, indicating that the patient has poor vision. So now we'll perform the prism cover.
You see, cover uncover test, alternate cover test in the beginning should all be done in the primary position, with the patient looking straight ahead, head in the primary position. Abnormal head, the cover uncover and alternate cover test should be done first in the abnormal head posture. Whatever patient is having abnormal head, face turn, head tilt, chin elevation, then you correct the posture and do it in primary position. Then you do it in all the directions of gaze. So the squint should be ideally measured in number 1, abnormal head position, number 2, in primary position, number 3, for near, number 4, for far, and in case of exotropia, for distant far. You ask the patient to look out of the door at more than 6 meters, more than 20 feet, and see what is the deviation. And in case of paralytic squint, when you are suspecting a difference between primary and the secondary angle, you have to measure it in all directions of gaze, so that you know in which direction it is more and in which gaze it is less. Okay, so start.
So as it is more than 45 degrees, so this prism bar is still 40. We'll place an isolated prism in front of the other as
Good. So you have seen that the angle is more than 45 degrees, and in the prism bar the maximum power prism is 45 prism diopters. So you place a loose prism, you should have either 2 prism bars, or you should place one loose prism in front of one eye and the prism bar in front of the other eye. Okay, so you will use a loose prism
आप इसको पढ़
in front of one eye.
So the direction is such that the apex is towards the direction of the deviation, and the prism bar is held.
Okay, so please do the procedure again and see how you perform the prism alternate cover test.
आपने इसको पढ़ते
So
रहना।
you have placed a prism, loose prism in front of the right eye. What is the power of the loose prism?
45.
45 prism
Prism
diopters.
diopters.
Okay, and you are now placing.
Now in placing the prism bar, I am starting roughly from 30 prism diopters as
Good.
ordered.
So if the angle of squint is 45 degrees, that is 90 prism So you start with 45 prism diopter in front of one eye and 35 in front of the other eye. Good. Instead of starting from the first prism of 10 prism diopter, you start with the appropriate prism, which is nearest to the actual value. Okay. Good.
इसको आपने पढ़ते रहना.
Okay, so you cover one eye and then you switch the cover to the other eye. Alternate cover test while kindly keep the prism bar close to the eye. Straight in the frontal plane of the eye. So it should be as close as possible. And we shift the cover from one eye to the other and keep the cover for 2-3 seconds so that the fuel is broken and the eye is sort of independent from the other. Brain stops fusing the two eyes. Okay, you repeat the cover a few times and see where the movement stops. So that is the angle of the squint. To confirm it, you can also proceed to the angle of reversal.
Yes.
Increase the power of the prism and see when the direction of the movement reverses.
So the amount of movement decreases, but as this patient has poor vision, we cannot clearly state as he does not take up fixation.
Okay, we will see the other patient. So you have to perform cover uncover test and alternate cover test quickly.
So first of all, I would like to take consent from an adult.
Okay.
Because age is not appropriate for the patient to give a consent. First checking the Hirschberg.
So in case of child, you can take the consent from the parents or attendant. Okay.
After taking consent, first checking the Hirschberg with the glasses and without glasses. सीधा बैठना है, ठीक है? रोशनी लड़ेगी, दर्द नहीं होगा आपके आँख में. Checking the Hirschberg.
So what are the findings on Hirschberg? You can tell.
On near Hirschberg, there is left deviation of about 15 to 20 degree towards inwards.
So make it a reflex. Always check the Hirschberg with glasses and without glasses. So ask the patient to remove the glasses and see the Hirschberg without glasses. And
on checking the Hirschberg without glasses, the findings remains the same with our left eye deviation of 15-20 degree inwards.
Okay.
Then we also have to check the Hirschberg for the far also. Now proceeding with the cover test. Covering the fixating eye, which is apparently the right eye. So now giving the target for the far, specific target for the far, and then a specific target. अच्छा आप उधर देखो पीछे वो निशान देख रहे हो?
Okay, you can show fingers. ये आप उंगलियों दिखाएं. ये कितनी उंगलियां हैं? So keep on changing the fingers. आपने बताना है कितनी उंगलियां हैं. So you have given a specific target for the far fixation. Good.
ठीक है बच्चे आप वो देखते रहो उधर.
So on covering, what information you get?
On covering the right eye, the left eye takes a quick fixation, central fixation on central. And performing the uncover test.
So on covering the right eye, the left eye takes up the fixation. Does the fixation becomes foveal? Is it central?
It is central.
The recovery is complete. Yes. What is the speed of recovery?
Is immediate recovery.
Immediate. So that will tell you the VN in the left eye. Is it 6/6 or is it subnormal? Is there amblyopia? So do cover test again. So once you cover the right eye, the left eye takes up the fixation and is straight. That means the fixation is foveal. Okay, so this is on cover test you have come to know. And what about uncover test?
On uncover test, the left eye also takes a fixation.
The right eye takes up
right
the
eye,
fixation.
right eye.
So is it alternate squint or is it unilateral
I would
squint?
like to do the alternate cover
No,
test. then
on this
mind.
cover uncover
it
test, what
seems-
information have you gathered?
It seems
Is
to
it
be-
alternate cover test or is it unilateral squint?
It is alternating.
It is not alternating. If you cover the right eye, the left eye takes up the fixation. But when you remove the cover, then again the right eye takes the fixation. Had the left eye been fixing continuously, then it would have been alternator. So this is a unilateral squint. The left eye is continuously deviating in on uncovering also. Do it again. So
बच्चे को देखो, आप सामने देखो.
the left eye is deviating,
Performing the cover test.
left eye is fixating,
Fixating. And then remove.
left eye is
Yes.
again deviating.
Exactly.
So only the left eye is at fault. So this is left convergent squint,
Yes.
right? So this is a unilateral squint. This is not alternating squint. Okay. So
Now performing the cover and cover test.
you have done cover and cover test.
Yes.
Now you will do alternate
Alternate
cover
cover
test. Okay. Again ask the patient to fixate either on a far object or you give a near target.
बच्चे आपने वो देखो. वो
उंगलियां नजर आ रही हैं आपको? वो देखो उसको
ठीक,
कितनी
चलो,
उंगलियां
देखते
बोलने
रहो आप।
बताना.
4,
ओके.
two,
So what are the findings on the alternate cover test?
Sir, on alternate cover test, there is, according to my examination, there is a deviation of right eye also, which I believe is a phoria manifesting on here.
See, the right eye under cover deviates and on uncovering comes
Yes, sir.
to take up the fixation. What is the direction of the
Of the right eye, sir.
of the right eye when you uncover?
Sir,
Do it again. You see, when you cover the right eye, the left eye is
Yes.
straight.
Yes, sir.
But when you alternate, the eye is coming from up down.
Up to down,
So
yes.
what is the differential diagnosis that comes to your mind?
As it seems to be doing.
Which is the condition in which the eye comes from above down?
So doing.
You have differential diagnosis of DVD, inferior oblique overaction and hypertropia. Okay. So this is the right eye coming from up down. What about the left eye? Do the alternate cover test. So the right eye is coming from above down.
Yes.
So that is hyperdeviation. The
And
left
the
eye
left eye is
is
from
going from
inwards.
iso
Yes.
to primary
Central.
position.
Yes.
Okay. So you have done it for far target. Now do it for near target.
जब ग्लासेस आते हैं ग्लासेस ना इसको ऐसे पकड़ना ठीक है बस इसको देखना अच्छा should I keep this arm distance or a half arm distance
No sort of, there is no strict policy. The patient should be fixing at the near target, which is accommodative. See, this target is good. It has miniature Snellen chart so that the patient can read. ABC आती है आपको? चलो पढ़ो ये ABC. So when the patient fixes at the target and sort of describes the details or reads the chart, it means the patient is focusing, fixating. Okay. Patient is accommodating. So
the
now
patient is बेटा
Try to
सर
keep
सीधा रखना
the
ठीक है ऐसे
head in the primary position.
ठीक है यहाँ सर नहीं लाना शाबाश now now covering the fixating eye which is the right eye so the cover test of the left eye and the uncover test of the right eye the right eye the left eye seems to be remaining in the inward direction with an angle of 15 degree it is not fixating centrally
So you are noting that the patient is gradually shifting to abnormal head position.
Yes.
The face is turning towards left so that the left eye becomes adducted,
Yes.
and the two eyes are straight. To avoid diplopia, the patient is turning the face to the left. So we want to examine the squint or measure the squint in the primary position. So again ask the patient to keep the head straight, or you can ask some assistant to keep the head by firmly grasping it. आप आ जाए ना, इसको ज़रा सर को पकड़ के रखें ताकि सर सीधा रहे.
बेटा अपने सर ऐसे
There
रखिए,
should
ठीक
not
है?
be
ऐसे.
abnormal head posture. First we have to measure it in primary position. Still the face is turning
Slightly.
towards left. थोड़ा सा इसको राइट पे टिल्ट करो ऐसे, बस अभी इसको
आपने ऐसे.
वापस नहीं आने देना ताकि प्राइमरी पोजीशन में चेक हो. सर सीधा हो एंड आईज शुड बी स्ट्रेट, हेड शुड बी फेसिंग straight ahead. Okay.
Now on the Hirschberg, near Hirschberg, there is a deviation, iso-deviation of the left eye of about 15 to 20 degree. On covering the fixating eye, that is the right eye, which आप इधर देखते रहना, ठीक है? इधर देखो शाबाश. The right eye, the left eye takes a fixation, central fixation, but it is of relatively low speed as compared to the far tested before. On uncovering, the left eye does not take any fixation, does not deviate. But the right eye, on uncovering, the right eye takes from upward direction to central fixation.
See, first we want to see whether the left eye takes up the foveal fixation or not.
Yes.
So, do you think that the eye is not becoming straight?
No, so not
You keep the cover on in front of the right eye for a few seconds and let left eye take up the fixation. So you have to cover the eye for a few seconds, the straight eye, so that the deviating eye is dissociated and takes up the fixation.
The patient is relatively uncooperative. I think that is the reason the results are ambiguous. तो आपने इधर देखते रहना, ठीक है? On uncovering, the right eye do take central fixation, moving from upward to inwards.
Okay, give me the torch and you perform the alternate cover test with Prism. See, when there is unilateral squint, there will be amblyopia and the eye would be lazy. So it is understood that the movement recovery would be slow. Okay. So in alternate squints, the VN will be good in both eyes and then the recovery will be fast. So you have to perform the alternate cover test. So there are two prism bars. You have to appreciate. One is having this vertical prisms and the other one is the horizontal. So in horizontal squints, you will use the horizontal prism bar. Okay, go ahead.
So on initial examination, the convergent squint seems to be of 15 degree, that is equal to 30 prism diopter. So I would like to start from 30 more or less, occluding the fixating.
Keep the target stay forward so that the eye remains in the primary position.
Now placing the deviation is towards inwards, then the apex will be placed in the respective position. I am starting from 25 prism diopter. अच्छा इधर देखना आपने ना, क्या देखते हैं बच्चे का performing the alternate cover test.
So keep the occluder for 2-3 seconds so that the eye takes up the fixation. When the eye is straight, then you change the occluder to the other eye or shift the occluder to the other eye. So, permit the eye to become straight and then alternate
बेटा आपने इधर देखना है आपने ना, और कहीं नहीं, यहाँ देखना है।
So you keep on
This left eye is remaining an inward constant.
So please perform the prism and the alternate cover test.
अस्सलाम वालेकुम, मेरा नाम डॉक्टर आमना है। मैं आपकी आँखों का मुआयना करूँगी। इस दौरान आपके आँख में थोड़ी सी रोशनी डाली जाएगी, लेकिन आपको किसी किस्म की जहमत नहीं होगी। अगर फिर भी अगर आप कहेंगे तो हम मुआयना रोक देंगे, ठीक है? इजाज़त है? सर, फर्स्ट ऑफ ऑल स्टार्टिंग विद द हर्शबर्ग टेस्ट, पेशेंट हैज़ एक्सियल डेविएशन ऑफ मोर देन 45 डिग्रीज।
Okay, let's have a look. इसको लाइट बताएं. So इस रोशनी को देखो. Okay. So there is left divergent squint. So you have a rough assessment of the squint with the Hirschberg. That how much is the squint? Is it divergent or convergent? So that you can start with the appropriate prism. Okay, good.
Sir, for a gross idea, I am going to
Now,
perform.
please.
For a gross idea, I am going to perform the cover test on the patient. ये पढ़ते रहिएगा, ठीक है? ये पढ़े. I am covering the fixating eye and observing the other eye. ये पढ़िएगा. Sir, the vision in the non-fixating eye is not enough for the patient to fixate.
So ideally, this patient should not be subjected to prism alternate cover test. You see, bifoveal fixation is necessary to have a good cover uncover or the prism cover test.
So in this patient, sir, we will perform the Krimsky test.
In this case, we can perform Krimsky test.
Yes.
Okay. So how will you do it?
I am going to finish the prism. Since I know that the deviation was around 45 degrees, so I'll go for a bigger power prism. Sir, individual one is 45, and then we have the 50. Can we pile it up?
Yes, you can place the two prisms on the two eyes.
Okay, sir.
You can have the assistance. आप पकड़ने दे सकते हैं.
Sir, in the other eye. Sir, where should I place it?
Okay. So in Krimsky test, you are increasing the power of the prism to a point where you see
रोशनी में देखिए.
the corneal reflections are in the center. So
रोशनी में ये रोशनी
this
में
can
काफी
be
सारी-
done in the non-cooperative patients in which you cannot perform the cover uncover test.
So now we have placed 95 prism diopters in front of his eyes, and the Hirschberg is almost central now.
Okay, good. That's all.